Imagine a person comes into an emergency room with a head injury and doctors need answers fast. Do they choose a CT scan or an MRI? Knowing the difference can mean understanding not just the test, but the clinical decision behind it. And for the EPPP, that distinction matters. A CT scan or computed tomography scan uses X-rays to create detailed images of the body. It's fast, widely available, and especially useful in emergency situations. For example, if someone comes into the ER with a head injury, a CT scan is often the first choice because it can quickly detect bleeding, skull fractures, or major structural damage. Think of the CT scan as a quick snapshot tool. It's efficient and great for identifying acute problems, especially involving bone or fresh trauma. On the other hand, MRI, magnetic resonance imaging, uses powerful magnets and radio waves instead of radiation. This makes it safer for repeated use, but also slower and more sensitive to movement. MRI provides much more detailed images of soft tissues, which is why it's preferred for examining the brain, spinal cord, ligaments, and subtle abnormalities like tumors or demyelinating diseases such as multiple sclerosis. One key test-taking point, and something patients often remember, is that MRI machines are much louder than CT scanners. During an MRI, the machine produces repeated knocking, thumping, or banging sounds due to the rapid switching of magnetic gradients. Patients are usually given earplugs or headphones because the noise can be quite intense. In contrast, CT scans are relatively quiet and quick, often taking just a few minutes, while MRIs can take 30 to 60 minutes or longer. Another difference is patient experience. MRI requires the patient to lie in a narrow, tube-like space, which can be challenging for individuals with claustrophobia. CT scanners are more open and generally more comfortable for those who are anxious in confined spaces. So for the EPPP, remember this. CT is fast, uses radiation, and is best for acute issues like bleeding and fractures. MRI is slower, louder, radiation-free, and excels at detailed imaging of soft tissues in chronic or subtle conditions. If you keep those contrasts in mind, speed, detail, noise, and use case, you'll be able to choose the correct answer on exam questions, as well as understand the clinical reasoning behind it.